Alright, Doc, we're doing great here. Are you comfortable?
I am.
Super. And for doctors who are watching, it's a patient with previous laser vision surgery, osteocorneal astigmatism. We just did a premium toric lens based LaZrPlastique surgery. And as usual, the patient has no anesthesia other than drops, correct, Doc?
Correct.
He's a wonderful dental surgeon, and we were just talking about how these technologies emerged. Doc, anything you want to say about your experience? We are nearly done.
Actually, it was a pretty pleasant experience for having surgery.
Wonderful. And I'm inside your eye. And doctor, as I keep teaching you all, there is no need for sedating patients and all those other paraphernalias, and they really do very well as long as you maintain your artistry in surgery. Minimal movements, elegant surgery, and these are very intelligent patients, themselves surgeons, and yet I keep asking them about pain, discomfort, right, Doc?
No pain.
Lovely.
Nothing the entire time.
And doctor, you can see me being very finicky. I'm even being very finicky about how the lens sits on the eye and the axis. Polish.
I appreciate that.
Right. Polish. So we are polishing the capsule, being really even more finicky. You can see the dots of the lens. That's the axis, exactly matching the axis that you can see on top here on the cornea. You can see it has to be perfect because you want perfection. Surgery is just a means for vision, so don't ever get lost in surgery. Doctor, been a pleasure. Congratulations.
Thank you so much.
We're all done.
Actually, it's funny that the lights are actually already clearer than when I started.
Yes.
I can see almost like the filaments,
Lovely.
and I couldn't see that before.
And for what doctors who are watching, again, this is not a simple LASIK surgery where people see immediately. I'm in his eye doing a cataract-based LaZrPlastique surgery, being very finicky. You can see everything is on point. The axis of the lens, my rexus, perfect circle. You're seeing the marks on the cornea matching right here. And more importantly, like I keep teaching, is the patient. The patient can immediately see right here, has no sedation, no drugs, besides only numbing drops. Right, doctor?
Yeah, exactly right. Did not hurt a bit.
Congratulations. Been a pleasure.
Thank you. I appreciate your help. I appreciate your professionalism.
Absolute pleasure. Absolutely. There we go. You look super.
Me-
Doctor, we're all done. How do you feel?
I feel great. Thank you so much.
Excellent. How was the experience here?
The experience was awesome. Again, I could see almost immediate, I could actually see the light more clearly at the end of the surgery than at the beginning. So that's pretty amazing.
Doctor, do amazing stuff for your patients like you do. It's been a real pleasure. And safe travels back. Excellent. All right, the doctor himself, he's all done.
Very good.
Yeah, everything went very well.
How was the experience, Doc?
It was a good experience. It was a very good experience.
Yeah.
Any pain, anything?
No, no.
Karen, like I mentioned, look at him walking out.
I know.
This is
Good.
cataract
I don't
surgery.
care yet.
Just doing my best to stare at the light the whole time. And as a matter of fact, I was telling him the light was clearer at the end of the visit than it was at the
Were you
beginning of the
nervous at all? I mean, come on.
Nervous? No. I was tense to make sure I didn't move, but I wasn't tense because I was concerned
Wow,
about the
15
surgery.
minutes, not even 15 minutes.
Yeah,
Pretty amazing.
that's pretty awesome.
And
It
you know,
was
being
very
a
awesome.
surgeon, he understands these intricacies, and like I
Yeah.
said, I make it more difficult for me. Now, his case is already complex with his previous surgeries and stuff,
Right.
but
Yeah.
it went beautiful. I'm proud of him. And he
That's
has
awesome.
no stitches, nothing. So just careful. Come,
So I'm
this
gonna be
way,
very
please.
careful for 2 days.
Okay.
Come, doc, right here.
This
Careful.
What more percent was the DX?
Doctor, we're all done. How do you feel?
I feel great.
Wonderful,
It was a
wonderful.
good experience. It really was.
Yeah.
I'm excited. Your spa is second to none. It felt like a personalized experience instead of just being a number, and I really appreciate that. Thank you very much.
Absolute pleasure, doctor. You're an amazing surgeon yourself,
Thank you.
and really was a pleasure.
And again, like I said, the things that you did for my vision will impact the patients that I see, because I'll be able to deliver just that much better care for my patients as well. And so that's because of you.
An honor,
very much.
An honor. Karen, look out for this amazing man.
I will.
And then here we go. So yes. for doctors watching. The wonderful surgeon, patient of ours, just nearly finishing his cataract surgery with LaZrPlastique mode, where we are trying to correct his posterior corneal abnormalities and history of previous refractive techniques. And as usual, all our patients, there is no anesthesia other than numbing drops, right, doctor?
Correct.
No drugs, no Valium, no sedation, no injections. Doctor, how's your comfort as I operated inside your eye?
We're doing fine.
Fantastic. And this is his second eye. We already did his first eye. Doctor, how do you feel? I'm in your eye. You have only numbing drops for anesthesia, no drugs, no IV sedation, and we are just finishing your surgery and being very finicky about placing the lens.
Correct.
And you with your previous posterior corneal astigmatism.
Uh-huh.
How do you feel? How's your overall experience, Doc?
Okay.
Super. Polish?
Polish.
Being finicky about all this, making sure everything is perfect. You can see the rexus
Sure.
very well covering the entire aspect of the lens there, also well centered. You see the axis matching the axis of the cornea here. Doc, you're all done. Congratulations.
That's awesome.
All right, Doc, we've just finished with your surgery. And for doctors who are watching, impromptu, and these are cataract-based LaZrPlastique techniques, no anesthesia other than numbing drops. Doctor, can you see anything at all?
Yeah, I can actually see the filaments a little better now than when I first started.
Beautiful. How was your experience in the cataract suite here?
It was good.
And this is his second eye, and Doctor himself is an amazing surgeon. Doctor, been a pleasure. Congratulations.
Thank you so much. I appreciate your help.
My pleasure. So here we are, we're done with Doctor. Again, we did a LaZrPlastique technique. We had done it for his first eye, his second eye in our suite. No drugs, no anesthesia other than drops. And Doctor, you saw immediately under the microscope.
Yeah, I did. I saw that. I saw the filaments better in the little bulbs I was looking at after than before.
Super.
So that's a pretty good indication this is going to work real well.
Wonderful. And his complexities from his posterior corneal astigmatism and previous laser refractive surgery, and the fact that, as usual, I want every level of refractive correction through this surgery. So, Doc, it's been a pleasure.
It's been a
Anything
pleasure.
you want to say about your experience here, second time?
It was a good experience. I'm very pleased. We had a lot of people closer that I could have gone to, but I had the ultimate confidence in Dr. Gulani, and it's worth the. I mean, I didn't drive as far as people in South Africa come over to see him, but it was still a hike to come see him, but it was worth it.
Good pleasure, Doc. Be amazing. You are amazing to your patients. Okay, here we go. Here is the doctor. Can you see her already?
Everything went great.
Everything
Yep.
went beautiful.
He did a nice job for me.
That's all right.
Probably put my map.
Congratulations. Absolutely, Doc.
Thank you very much. I appreciate your help.
Come.
Thank you very much. I appreciate your help. I'm looking forward to having that great vision I think I'm going to have.
This is your second eye, and for doctors watching, here he is straight out of his cataract surgery. No stretcher, no drugs, just numbing drops and
No problem. Yeah, I
Wonderful.
much prefer it that way.
Yep. And this is your experience second time here. We did your
Second
first time,
time.
Doc. So
Yep.
anything you want to tell doctors, because I keep exposing my place for them to inspire them worldwide.
He does have. This is a wonderful concept of the spa experience. A lot better than feeling like a number where you're just kind of shoved in and out. He meets you at the door in the morning and talks with you about any concerns you have. It's a very hands-on, personalized service, and I think that's very professional.
Can't have it any other way. I love that. Doc. So congratulations.
Thank you very much.
Pleasure.
Thank you for everything.
Thank you.
Not pleasure.